हेलो, वेलकम टू द पैरासीटामोल एंड वेलकम टू द पैरासीटामोल शो एंड मैं हूँ डॉक्टर पुरवेश और मेरे साथ आज है डॉक्टर करण आशुदानी। आज ये जो लेक्चर होने वाला है ये है यूएस मेडिकल स्कूल में एडमिशन कैसे लेते हैं और उसका क्या प्रोसेस है। और इस लेक्चर में हम इंडिया के मेडिकल जो एजुकेशन है और यूएस का जो मेडिकल एजुकेशन है उसके बारे में डिटेल में इंफॉर्मेशन लेंगे। एंड मुझे पता है ये डॉक्टर करण से मैं दिल्ली में मिला था जब मैं अपना USMLE जो स्टेप 1 की प्रिपरेशन कर रहा था और साथ में मैं सफदरजंग हॉस्पिटल में जॉब भी कर रहा था उस टाइम पे। तो मैं तब वहाँ पे डॉक्टर करण को मिला था। वेलकम डॉक्टर करण एंड थैंक यू फॉर गिविंग मी दिस टाइम, आई रियली अप्रिशिएट।
थैंक यू डॉक्टर पुरवेश।
या थोड़ा सा आपका इंट्रोडक्शन हो जाए।
ठीक है, मैं कोशिश करूँगा। एक्चुअली मेरा पहला भाषा हिंदी नहीं है, तो माफ़ कीजिए अगर बीच में कोई गड़बड़, मेरी हिंदी में गड़बड़ हो जाए तो माफ़ कीजिएगा।
कोई बात नहीं।
मैं पुरवेश से मिला था 2 साल पहले जब मैं भारत आया था। मैं एक्चुअली इंडिया आया था आयुर्वेद और योगा की कोर्सेज लेने के लिए। तो उस टाइम I met Purvesh and we became really good friends.
Yes.
And yeah, I've known him since then. Purvesh बहुत ही determined और entrepreneurial doctor है, and he will do very well in life. And everyone please support his channel.
Please do subscribe, guys.
Please subscribe. He has really good content. Yeah.
Okay. So ये बात बड़ी अच्छी है कि ये भाई साहब अपने मेडिकल स्कूल में थे। यूएस में जो मेडिकल स्कूल होता है ना, हमारे इंडिया में MBBS तकरीबन 6 साल का होता है ना, 5 साल स्टडी एंड 1 ईयर इंटर्नशिप। यूएस में वो 4 साल का होता है, 2 साल स्टडी एंड 2 साल इंटर्नशिप, जो उसको रोटेशंस कहते हैं। तो वो अपने 2 साल की स्टडी फिनिश करके कैम टू इंडिया आयुर्वेदा एंड योगा लर्न करने के लिए। तो ये एक बड़ी अच्छी चीज़ होती है। बाहर के जो लोग होते हैं, बाहर के जो एजुकेशन सिस्टम में जो लोग होते हैं, वो अपना थोड़ा सा टाइम ब्रेक लेके कुछ एक्स्ट्रा चीज़ें भी सीखते हैं। हमारे इंडियन सिस्टम की तरह नहीं है कि शुरू करा स्कूल से, शुरू करा किंडरगार्टन से, शुरू करा स्कूल, हाई स्कूल, कॉलेज और फिर जॉब ले ली, शादी वादी करके सेट हो गए। कोई एक्स्ट्रा स्किल नहीं आती है। ज़्यादातर है ना 95 बच्चों को कुछ एक्स्ट्रा चीज़ें नहीं आती है। नो म्यूज़िक, नो कुछ योगा वगैरह तो दूर की बात है। अपना कल्चरल रिलीजियस चीज़ें भी नहीं पता होती जितनी बाहर के लोगों को पता होती है। सो ये एक अच्छी चीज़ है। तो करण तब आए थे दिल्ली, श्री अरविंदो आश्रम में वो रुके थे आई थिंक, और वहाँ पे वो योगा एंड वो सब चीज़ें का जो डिप्लोमा कोर्स कर रहे थे, उसी टाइम पे मैं उनसे मिला था। ओके, सो करण, so what are you doing now currently? क्या कर रहे हो आप?
Currently I'm in my 3rd year of medical school. I have about 1.5 years left.
Okay, so 3rd year of medical school मतलब कि आपने अपने 2 साल खत्म कर दिए and the 3rd year जो rotations चल रहे हैं आपके।
Exactly.
Okay. So स्टार्ट करते हैं। क्या एडमिशन प्रोसेस है यूएस में? यूएस में मेडिकल स्कूल में अगर एडमिशन लेना है तो क्या सिस्टम है? जैसे इंडिया में तो है ना कि हाई स्कूल खत्म किया और फिर सीधा MBBS में जंप कर गए, तो क्या सिस्टम है?
हाँ, पहली बात यह है कि हमें समझना चाहिए कि दुनिया में 2 सिस्टम्स है। एक है ब्रिटिश सिस्टम और दूसरी है अमेरिकन सिस्टम। ये दोनों सिस्टम बहुत ही अलग हैं। Most countries in the world follow the British system because Britain ने पूरी दुनिया को colonize किया।
बिल्कुल।
And that is why this system is more common. So in the British system, you have to be a doctor. You first finish your 12th grade, okay, which is high school, also known as high school in the US.
Yes. Okay.
And then you're 18 years old at that time, and then you apply for a MBBS degree, which stands for Bachelor of Medicine, Bachelor of Surgery.
Correct.
So it is a double bachelor's degree. And that takes between 5 to 6 years. And after that, you are a doctor. No questions asked. Now, in the US, The system is very, very different. So let's think about it this way. If you're in India and you wanted to do you wanted to be a expert in music or art or economics, so kya karenge pehle? You will do bachelor's of music, maybe master's in music, and then PhD in music, or bachelor's in economics, master's in
Masters in
economics,
economics and
and then
PhD.
PhD in economics,
Correct.
right?
Yes.
Now, after that, you become a doctor in economics or a doctorate in art or music or whatever.
Music, whatever. Yeah.
Now, in the US, the thinking is, why is it that for all fields, I have to do a PhD,
Mm.
but when I'm dealing with human lives, when I'm a medical doctor, I should apply the same standard. I shouldn't have a shortcut. I should also do a bachelor's, a master's maybe, and a doctor in medicine.
Medicine.
It's not fair. So the thinking is, in the US, to become a doctor, once you're done with high school or 12th grade, you enroll into a 4-year bachelor's degree. Okay. And then right after, you do a master's degree, which is optional.
Exactly. Okay.
And then you do a 4-year MD degree,
MDD.
which is equivalent to a 5 or 6-year MBBS degree.
MBBS degree.
Okay. Understand that the MD or the DO degree, that 4-year degree in the US, is an entry-level degree like the MBBS degree in countries that follow the British system, like
Yes.
India, Bangladesh,
Yes.
Pakistan, Singapore, Australia, New Zealand.
Correct. तो आप लोगों को ये भी पता होगा इस बारे में कि जो यूक्रेन, रशिया, जॉर्जिया, फिलीपींस से जो पढ़ के आते हैं फॉरेन मेडिकल ग्रेजुएट्स, उनकी जो डिग्री होती है वो उस पे एमडी लिखा होता है, लेकिन वो इक्विवेलेंट टू होती है एमबीबीएस. ओके. और एक इसका वो अच्छी चीज है एमबीबीएस की है कि एज एमबीबीएस आप इंडिया में या फिर यूके में भी एज अ जनरल प्रैक्टिशनर आप काम कर सकते हैं. बट यूएस में एमडी के बाद आपको स्पेशलाइजेशन करना पड़ता है. स्पेशलाइजेशन इन द सेंस के पीडियाट्रिक्स, न्यूरोसर्जरी, जनरल सर्जरी, इंटरनल मेडिसिन, इसमें स्पेशलाइजेशन करने के बाद ही आप एज ए डॉक्टर काम कर सकते हैं. वहाँ पे यहाँ पे जनरली कोई जनरल प्रैक्टिशनर वाला कंसेप्ट नहीं है. हाँ, फैमिली मेडिसिन है वहाँ पे, लेकिन वो भी एक स्पेशलाइजेशन में है. ओके. सो आपका कहना ये है कि आफ्टर हाई स्कूल आपको बैचलर डिग्री करनी है इन एनी फील्ड, चाहे वो इकोनॉमी हो, चाहे वो म्यूजिक हो, चाहे वो साइंस हो, चाहे वो बायोटेक्नोलॉजी हो, कुछ भी हो, उसमें पहले आपको बैचलर्स डिग्री करनी है एंड देन आपको मास्टर डिग्री भी करनी है. उसमें
ऑप्शनल है.
ओके, ऑप्शनल है मास्टर.
लेकिन अगर मास्टर्स डिग्री करें तो आपके चांसेस ज्यादा अच्छे होंगे,
ज्यादा होता है कि मेडिकल स्कूल में मैच होना है. ओके. और उसके बाद आप मेडिकल स्कूल में जाते हैं और वहाँ पे आपका जो कोर्स होता है वो 4 साल का होता है. 2 years फॉर मेडिकल स्कूल एंड 2 years फॉर रोटेशंस लाइक इंटर्नशिप. ओके. सो आपने क्या किया है?
मैंने क्या किया? Okay, so I finished the GCE A levels in Singapore. I'm from Singapore, born and raised, and that is the equivalent of 12th grade in the US. Then I did national service, went to the Singapore Armed Forces for 2 years.
Yes, that's mandatory for small countries.
Yes, so being a small country, we don't have a large population like India, so we need to make all males, serve in the military to be trained.
Yes.
So I did that for 2 years. Then I moved to the United States, and I did my 4-year bachelor's degree. I did 2 bachelor's degree in 4 years. I did a BA in economics and a BS in human physiology.
मतलब 4 साल में आपने 2 डिग्रीज करी?
जी, और बहुत ही स्ट्रेसफुल था. मेरा समर वेकेशंस नहीं था, so it was being a Sindhi, I thought since my parents are paying so much money, I should take advantage of it and get 2 degrees for the price of one.
Oh. Okay, that's a smart move. Okay. Yeah. And then you applied for medical school.
And then after I finished my bachelor's degree, I did some research in neurosurgery.
Oh, neurosurgery. You did research after that?
Yeah, I did
Okay.
research. Then I did my master's in nutrition.
Okay.
And then I worked for a while as a nutritionist. And
Okay.
then I applied to medical school.
ओके सो जैसे आप सबको पता है कि इन इंडिया क्या होता है कि हाई स्कूल के बाद सीधा एमबीबीएस में एडमिशन होता है और तब तकरीबन एज जो होती है 18 साल होती है एंड 18 ईयर्स और उसके बाद जब मेरी बात कर रहा हूँ मैं 18 ईयर्स में मैंने एमबीबीएस स्टार्ट किया 23rd और 24th में मेरा एमबीबीएस खत्म हुआ था यूएस में सिस्टम नहीं है यूएस में पहले आपको बैचलर्स करना है देन आपको अच्छे मेडिकल स्कूल में एडमिशन लेना है तो आपको मास्टर्स भी करना है एंड देन आप जा सकते हो तो उस टाइम पे ही एज जो होती है 24-25 हो जाती है और ये सब चीज़ें जो होती है ना वो एक्स्ट्रा करिकुलम आपकी इंटरेस्ट और आपकी मैच्योरिटी बढ़ाने के लिए होती है कि आप एक बड़ी चीज़ के लिए प्रिपेयर हो सके है ना करेक्ट करण
Yeah, and also you're dealing with human lives.
यस
That is very important, right? You need mature people to enter the field.
यस यस
Yeah.
एंड उसमें ये लोग ये लंबे लंबे कोर्स से ये भी वो करते हैं कि बंदे का पेशेंस लेवल कितना है अगर ये जो
बिल्कुल।
4-5-6 साल जो है मैं बैचलर मास्टर के सहन कर गया एंड
हम्म।
देन मेडिकल स्कूल में आता है तो उसका लेवल कुछ और ही होता है एंड इंडिया
क्योंकि
में
4 साल बैचलर्स करने के बाद most of us we want to make money, we are tired of studying, and if at that age you still want to go into
बिकम अ
medical school,
डॉक्टर
it means that you're truly passionate and you will be a good doctor.
करेक्ट करेक्ट
जैसे कि
इंडिया
इंडिया में ये होता है, जहाँ तक मैंने देखा है कि लोग अपने माँ बाप के प्रेशर में आके MBBS या इंजीनियरिंग करते, फिर 4-5-6 साल के बाद उनको लगता है कि दिस वाज नॉट माय पैशन, मुझे डॉक्टर नहीं बनना है या मुझे इंजीनियर नहीं बनना है. So the engineers start doing MBAs,
करेक्ट
and the MBBS grads start doing something else.
समथिंग एल्स
So
करेक्ट
देखो, इंडिया ने इतना इन्वेस्ट किया लोगों के एजुकेशन में, but then after that 20% of doctors and engineers leave, maybe more, I don't know the numbers. So it's a waste of resources for India.
सो आई मीन यू कैन इमेजिन कि मेडिकल स्कूल में एंटर करने से पहले कि यहाँ पे लोगों के पास जो स्टूडेंट्स होते हैं उनके पास रिसर्च का एक्सपीरियंस होता है वेरियस अदर डिग्रीज वेरियस अदर ऑप्शंस भी होते हैं उनके पास तो वो फुल्ली लोडेड होते हैं कि भाई अब मैं रेडी हूँ टू एंटर इनटू द मेडिकल स्कूल ओके सो उसके बाद क्या कुछ एंट्रेंस एग्जाम वगैरह होता है जैसे इंडिया में नीट यूजी होता है एमबीबीएस में एडमिशन लेने के लिए क्या ऐसा कुछ एग्जाम वगैरह कुछ होता है
Yes.
क्या
So
प्रोसेस होता है इसके बाद
yeah, so the first entrance exam is from 12th grade or from high school to bachelor's degree. That is the SAT exam or the ACT exam. Either of these are accepted. We'll not go into that because that is before
सेपरेट थिंग
university. Now, after you're done with your bachelor's, there is an exam called the MCAT, MCAT, Medical College Admissions Test.
ओके करेक्ट
Okay.
ओके
The Medical College Admissions Test is an entrance exam for medical school. And if you can let me share my screen,
ओके करेक्ट
I can show you. I think I'm able to share my screen. I can show you what the MCAT exam is actually about. Okay, so are you able to see my screen,
यस
Dr.
आई कैन
Purvesh?
सी यस आई कैन
Okay.
सी
So if you look at the MCAT exam, okay, it comprises these fields. So let's say you have 230 questions. 15 questions will be in introductory physics, okay, which is here. 30 questions will be in biochemistry. 45 questions will be in biology. 53, they call it CARS, but just to simplify it for you, it is actually English. Okay, test your English knowledge, your reading and writing skills, mostly reading, critical reading skills. That I feel is one of the more challenging sections. Because the people who set the exam, who set the CARS section
कार
of the
सेक्शन
MCAT exam, are also people who set the LSAT exam, which is used for law school.
ओके
So imagine the standards of English for someone who's going into law school and someone who's going to medical school is the same. So this exam is very difficult.
Very difficult.
Okay. Then you have general chemistry, which is here, organic chemistry, and psychology and sociology. Okay, so it is not, it is therefore recommended that during your bachelor's degree, you could be doing any major, any degree, but you should have taken a few courses in these fields so that you prepare yourself for the MCAT exam.
MCAT exam, exactly, correct.
Okay, and let's look at another picture here. So the MCAT scoring is showing here that about 50% is science and 50% is not science.
Not science.
So it's the English section, psychology, sociology, and bio. I think this might be maybe not human biology or some other biology, maybe evolution or that kind of stuff.
Yeah, that kind of stuff. Yes. Okay.
Yeah.
Okay.
So this is just to give you an idea of what the MCAT exam is. And let me just share with you another slide. Okay, if we look at prerequisites for medical school, so this is the website for how.
Yeah, this is a stuff from Harvard Medical College.
Yeah, so अभी ये है हार्वर्ड मेडिकल स्कूल की एडमिशंस पेज पे हम हैं और यहाँ पे लिखा है कि एंट्री के लिए क्या क्या प्री रेक्विजिट कोर्सेस करना पड़ता है recommended है okay so they recommend behavioral sciences which includes psychology and sociology 1 year with lab experience of biology should include cellular and molecular aspects. Then you have chemistry and biochemistry, 2 years of chemistry or 4 courses, okay? And then you need 1 year of physics, and lab is desirable but not required. Okay? And then math, and then writing. You need writing for sure. Writing is very important, and math. So you have to fit all these prerequisite courses
before entering to the...
Yeah, into your degree, whether the degree is music, if you're majoring in music, okay, you do the music courses, plus you have to do these prerequisite courses.
And in physics, there is a written that lab experience is desirable but not required. But you have to do, because competition and everything is very high. So you have to do this to make your CV stronger than other people, right?
Yeah, the reason why I think they put physics is desirable but not required in terms of lab is because physics is not as applicable to medicine as much as biology and chemistry is. So that is the reason. Yeah. And yeah, I will just pause my screen sharing. Okay.
Yeah. Okay. So we talk about the MCAT. MCAT is an entrance test, entry-level test to enter into the medical school. Okay. So, आपने भी दिया होगा MCAT?
I took the MCAT exam. It was very tough.
Okay.
I think I did it. I took the MCAT 3 times.
Okay.
So that I could get a good score to apply. So it required a lot of determination.
मतलब pass होना important नहीं है, score लाना important है ना?
Yeah. And the thing with the MCAT is the number of attempts are the number of attempts is less important when you compare it with the USMLE.
USMLE, yeah. That's a different. Okay. So क्या होता है कि कोई अगर इंडिया से कोई स्टूडेंट यूएस मेडिकल सिस्टम में एंटर करना चाहता है तो उसको भी पहले हाई स्कूल कॉलेज करना पड़ेगा या फिर वो डायरेक्टली एमकेट दे के एडमिशन ले सकता है?
Depends on the medical school. लेकिन जहाँ तक मैंने देखा है, most of the time when a medical school looks at your transcript, they want a transcript from North America. They accept a transcript from North America, which is either USA or Canada. So they would like to see that you've done at least the prerequisite courses in US or Canada. So you can have a bachelor's degree from India in another field, but the prerequisite courses, which is physics, chemistry that we saw just now, should be in the US or Canada. So what you hypothetically can do is do a 3-year bachelor's degree in India, come to the US, take these prerequisite courses, take the MCAT and apply.
Yeah. So कुछ भी बैचलर कोर्स करिए कोई सा भी जिसमें आपको इंटरेस्ट हो, then come to USA and do this prerequisite courses and then do MCAT and take admission. Okay.
और
Alright.
ये दूसरी बात भी इंटरेस्टिंग है कि यूएस में मेडिकल स्कूल्स में स्टेट कॉलेजेस है और प्राइवेट कॉलेजेस है. तो प्राइवेट कॉलेजेस, प्राइवेट मेडिकल स्कूल्स will accept international students.
Okay.
लेकिन very few
Government.
state medical schools will take international students, very few.
फिर एक और क्वेश्चन ये उठ के आता है कि फीस क्या है? फीस क्या है? कुछ बहुत ज्यादा महंगा है मैंने सुना है. It's very expensive.
फीस आप बैचलर्स के पूछ रहे हो या मेडिकल स्कूल?
मैं मेडिकल स्कूल की पूछ रहा हूँ. बैचलर्स का छोड़ दीजिए, वो हो गया.
हाँ, तो मेडिकल स्कूल में फी स्ट्रक्चर दो हैं. एक है स्टेट यूनिवर्सिटी मेडिकल schools, which is, let's say, if you're from California, okay, you're a resident of California, you have a California license, and you apply to any of the UC schools, University of California schools, then your tuition fee could be from $35,000 to $45,000 a year.
35 से 45,000, 35 to 45,000. Okay.
And
उसके बाद
if you're from, if you're from outside of California and you want to go to California school, then it's 55 to 75,000 a year.
That's very expensive.
But this is for California. There are 50 states in the US. I'll give you another extreme. California is probably the more expensive one. I'll give you another extreme.
Yes.
The other extreme is, let's say, Mississippi. Okay. Now, if you're from Mississippi, then your yearly tuition fee is only, I think, 16 to 18 or 20,000.
Oh, okay.
Okay. And if you're from outside of Mississippi, then it's more, but I'm not sure. So it's a huge country with huge variation.
Huge variation. Okay. So one more question which is coming in my mind. So after that, MCAT has only one step, like it's a single exam.
Yes.
MCAT? Okay. And after that, you need to give interviews or something?
Yeah, you apply, you send in your application. In the application, you have to write a personal statement. You have to jot down all your activities, all your extracurricular activities. You have to jot down your volunteer experience, your research experience, if you have them. And then you send in an application through a centralized application service. And then you wait. You pay the amount of money, you pay the application fee, and you wait. And there's a primary application and a secondary application. So this is the primary application.
Okay.
Now, these medical schools will receive thousands and thousands of applications from all around the US.
Yes, correct.
And they'll do a screening. If they like you, they'll say, oh, I like this guy. I like Dr.Purvesh. Let's give him a secondary application.
Okay.
So they'll send you a secondary application and you will get, let's say, a secondary application. They'll ask you to write 2 more essays or 3 more essays. Dr. Purvesh, let's say you're applying to Harvard University for medical school. Dr. Purvesh, why Harvard University?
Okay.
How do you think Harvard Medical School will fulfill your goals? And then you send that application
to them.
Okay. And then you wait again. And then they call you for an interview. And when you get an interview, then you show up and they have different styles of interviews again. Some schools use MMI interview, which I think is very interesting. MMI stands for multiple mini interviews. Okay, so when I interviewed at University of California Medical Schools, they loved MMIs. So they have 10 stations. Okay, बहुत ही दिलचस्पी चीज है how they assess you, you know. जैसे कि एशिया में सिर्फ स्कोर्स देखते हैं, सिर्फ जीपीए देखते हैं,
और कुछ नहीं देखते. स्कोर अच्छा है तो एडमिशन मिल जाएगा.
एग्जैक्टली, यहाँ पे देखना चाहते कि आप कैसे सोचते हैं, कि आपकी माइंड कैसे चलता है. ये इतना जरूरी नहीं है कि आपके स्कोर्स अच्छे हैं. आई मीन एक हद तक है इम्पोर्टेंट, लेकिन उससे ज़्यादा these things are important. So let's say they'll have one station, they will give you like maybe a block set or a Lego set, and you have another partner, another medical school student interviewing. So they will say, one of you is facing the wall and one of you is facing the blocks. Okay? So the guy who is facing the wall, who cannot see the blocks, has to try and explain to you how he wants the figure to be done. And then the other guy has to do it according to his instructions. So what are they trying to test here? Teamwork. So first station, teamwork. Second station, they might ask you a question about, I got a question on transgender. If you, Dr. Karan, you're going to be a doctor, you have a transgender patient coming to you who wants to do a sex change operation, how would you deal with it? And they give you so many details कि आप details में डूब हो जाए, लेकिन they don't want to see what details you give. They just wanted to see if when you refer to the patient, do you say he, do you say she, or are you gender neutral? So if you were gender neutral, then they know this guy is good. This guy that's what they wanted to hear from you. This guy is speaking gender neutral, and they distract you with all these details, but that's not important. So they have 10 stations with assessing teamwork, assessing, maybe IQ, assessing logical thinking, assessing emotional intelligence, EQ. They have 10 stations like that, and then they have a score. Each station is 10 points, and then they rank you. And then after that interview, they rank you.
बहुत जटिल और बहुत कॉम्प्लिकेटेड है, बहुत कॉम्पिटिटिव प्रोसेस है। नहीं, इंडिया क्या होता है कि जस्ट नीट यूजी दो, आपका जो स्कोर आया उस हिसाब से मेरिट लिस्ट बनेगी, अपनी चॉइस फिलिंग करो और अपनी जहाँ पे एडमिशन मिल रहा है वहाँ पे एडमिशन लो। अगर नहीं मिल रहा है तो फिर चाइना, रशिया, जॉर्जिया, यूक्रेन, फिलीपींस चले जाओ अपना बैचलर्स करने के लिए, मतलब MBBS करने के लिए। जबकि यूएस में पूरा सिस्टम अलग है, पहले हाई स्कूल करो, फिर कॉलेज करो, फिर मास्टर करो, और उसके बाद MCAT, एंड आफ्टर MCAT में अच्छा स्कोर होने के बाद आपको इंटरव्यू मिलेंगे, इंटरव्यू में भी वो लोग आपको असेस करेंगे पूरा अच्छे से। तो बहुत ही कॉम्प्लिकेटेड प्रोसेस है। ओके, सो मुझे भी लगता है आपका जर्नी भी ऐसे ही कॉम्प्लिकेटेड रहा होगा।
Yes, it was very complicated. Yes.
कैसे डील किया फिर इन सब चीजों से?
Well, for me, I wanted to do it. I wanted to be a doctor, so I was prepared to do it. So, and when you're prepared, then God helps you.
Yes, correct.
So
when you are determined for something, of course there is some power which gonna help you.
Yeah.
Okay, all right. So moving to the next, and then you will start your medical school, then 2 years of pre-clinical courses like anatomy, physiology, pathology, pharmacology, and all those things. And then you have to take admission, you have to start your rotations, and before starting the rotations, I think you need to pass USMLE step 1 exam, right? So USMLE step 1 exam में ऐसा नहीं है कि सिर्फ US के बाहर के लोगों के लिए है, जो US में पढ़ रहे हैं मेडिकल स्कूल में उनको भी USMLE देना है। And after passing the USMLE step 1, then only you can take you can start your rotations. Okay. And tell me the very small difference between DO and MD. And for DO, I think there is a COMLEX and or step 1, whatever they want to give. And for MD students, only step 1, right?
Yeah.
Right? Okay.
So MD stands for Doctor in Medicine. Okay. And DO stands for Doctor of Osteopathic Medicine. Okay. Now the MD and DO are both fully licensed physicians in the US. MDs make up about 75% of doctors in the United States, and DOs make up about 25% of doctors in the US. The difference between MD and DO is a DO doctor has a more holistic approach. And an MD doctor is fully allopathic. Okay. And a DO doctor studies what an MD doctor does, which is allopathic medicine, plus he
holistic
has
medicine.
a skill of osteopathic manipulation. And it's called OMM, osteopathic manual medicine,
Okay.
which is kind of similar to what a chiropractor does.
Mm.
But this is a side skill. So let's say if you have, if I'm a patient who comes in with some back pain and I go to an MD doctor, okay, the MD doctor was like, yeah, let's just give him some NSAIDs and send him
Yeah,
home,
yeah,
right?
ibuprofen वगैरह कुछ
Decrease
दे के भेज दो करके. Yes, correct.
exactly. And you know that, with NSAIDs, if a patient's on NSAIDs for too long, it can cause renal or kidney problems in the long term,
Problems.
right?
Yes, correct.
Now, if a patient goes to a DO, the DO will try and evaluate, okay, let's see, is this a musculoskeletal problem? Is this a bone problem? Is this a chronic problem? Is this acute problem? And he'll first try a non-pharmacologic approach. Okay, so first he'll use osteopathic manipulative medicine, which is adjustments and manipulation. And if that doesn't work, then he might go the NSAID route.
Yes. Then we will go to the allopathy.
Yeah. So a DO doctor has full training of what an MD has, plus an extra toolkit that they can use their hands to heal, which is very powerful. So that is the difference between MD and DO.
And then for those who are in MD and if they want to start their rotations, they have to use USMLE Step 1 exam. And for those who are from DO degree and if they want to start their rotation, they have to give USMLE Step 1 or COMLEX 1, right?
They have to do the COMLEX level 1 exam, and it is optional for them to do the USMLE Step 1 exam, but it is recommended because 75% of doctors are MDs, and that gives us standardization.
You are going to compete with them during the match.
However, by law, both exams are equivalent. But, sometimes there is going to be some bias. So, yeah.
और उसके बाद उनका रोटेशन स्टार्ट होता है, the रोटेशन खत्म होता है, उसके बाद वो लोग during the rotation you can give USMLE Step 2, right? Correct?
Yes, yeah.
Yes. और उसके बाद वो लोग ग्रेजुएट होते हैं मेडिकल स्कूल से and then they will apply for residency. Residency means PG, post graduation, for certain specialty like pediatrics or whatever, internal medicine or like that.
Yeah.
And then they become a specialist doctor. And for super specialization, they do fellowship. In India, it's a DM, right? DM neurology, DM cardiology. But here in USA, it's a fellowship. Fellowship in cardiology, fellowship in interventional neurology, like that. Okay, so that is a totally different area. And on USMLE, I already made one video, so you can watch. I will put a link in description box. All right, so this is a full view of US medical system. So now for those who don't match in US medical school, है ना, जिनको एडमिशन US मेडिकल स्कूल में नहीं मिलता है, वो लोग जाते हैं कैरेबियन कंट्रीज में या फिर साउथ अमेरिकन कंट्रीज में अपना एमडी करने के लिए, अपना मेडिकल स्कूल करने के लिए. तो इसका क्या सिस्टम होता है? उनको भी एमकेट के थ्रू एडमिशन मिलता है वहां पे?
So the Caribbean system is slightly different. You have two ways of entering a Caribbean med school. Now you must understand that Caribbean medical schools are a business. Okay, so they are trying to. They're fully private run. They need, students. They need tuition fees for them to stay alive. Okay, so they are going to relax the entry requirements. And because they're going to relax the entry requirements, US residency program directors do not have a very good impression of Caribbean medical school graduates. Okay, because they view that the quality may not be as good, or the quality of students going in may not be as good. However, having said that, I have seen many Caribbean medical school grads who are doing very well. But if you look at percentage-wise, it is definitely much lower. Now with Caribbean medical schools, they have, I'm not 100% sure, but I think they have two pathways of entry. First one is they follow the British model where you do 2 years of pre-med and 4 years of medical school.
Okay.
So you
Like
can,
BS, that 2 year of pre-med, there is a
yeah,
BS, right?
something like that.
Mm.
Okay. So that allows people to start, early.
Mm.
The other or the more common pathway is, a US or Canadian medical school student finishes 4 years of bachelor's degree,
Mm.
took the MCAT, applied maybe once, maybe twice, did not get in to a US or Canadian medical school. It's like, I'm tired of applying again. Let me go to the Caribbean. So they do that and they get in and they do a 4-year Caribbean medical degree. And the curriculum is exactly the same as the US
Yes.
medical school. Yeah.
Okay. Okay. So if you want to go after high school, you can go, right? You can go directly to the Caribbean countries.
I think some of the Caribbean schools allow that. Yeah.
Even if you have done your high school from US.
Yes.
So I think I covered almost all the questions, and fees are very much similar to the US medical schools, right?
Yes, I think they are similar in about 50,000 a year, around there.
So thank you, Dr. Karan. ये session बहुत अच्छा था.
Yeah,
I think
wanted to add one more. I want to add one more
Please,
thing. One more
please,
thing.
go ahead.
So there are a few programs in the US, a few universities in the US that have a accelerated medical program.
Okay, accelerated
Okay.
medical.
Accelerated. One example is Boston University. They have a accelerated 7-year medical program. Okay, which means in high school, if you've done really, really well, and you want to be a doctor, you apply and they interview you. The process is very, very competitive. And once you get in, it's 7 years. So they have reduced the bachelor's portion to 3 years. And then right after that, there is no break. There is a direct MD 4-year program. So you don't have to you have to do the MCAT, but you don't have to apply and wait and all that
All
stuff.
those stuff.
So it's like almost, if you meet a minimum MCAT score and if you are okay with the interview or kind of average with the interview, then they let you in. So there are few universities that have such programs. So that is also another thing that I forgot to mention. Yeah.
Okay. I think I covered almost all the questions, and thank you for this session, Karan. I really appreciate. And guys, if you have any questions, you can ask Dr. Karan. I'm gonna write his Instagram ID here. But do not bother him so much. You can also comment in the comment section, and I think I will me or Karan gonna reply those questions. Okay. All right, no worries. Okay, so write down whatever questions you have in the comment section, and we're gonna answer. All right. So thank you, Karan. Thank you for joining. And any closing statement?
Thank you, Dr. Purvesh. And I want to wish all, I'm assuming the audience here is mostly from India. I wanted to wish you all the best in your journey, and remember who you are, and don't forget your roots.
Yes.
Don't forget where you've come from. Yeah, all the best and
कहाँ से आए हो?
good luck.
ये नहीं भूलना है. And consistent रहना, इसमें patience ही important है. आपका जितना patience level अच्छा है, उतना ही आप बेहतर होके निकलेंगे. Correct. So thank you. Have a good day.
Thank you, Dr. Purvesh. Bye.